Before you touch the patient, wash your hands, introduce yourself to the patient and to the parents if the patient is child. Explain parents and the patient what you are going to do. Confirm patient's name and date of birth. Take the consent, detailed history, then proceed with the physical examination. Under general inspection from a distance, look at the appearance of the patient and the behavior. Observe his activity and alertness, and look for pallor, which indicates presence of anemia, which has got the bearing on the cardiac function. Look for cyanosis, which is bluish discoloration of the mucous membranes and the extremities. Look for edema of feet, which indicates presence of congestive heart failure. Observe for shortness of breath and look for rashes. But not last but not the least is dysmorphic features like features of Down syndrome, Turner syndrome, etc. Look at the face for dysmorphic features. Features of Down syndrome. The patient has got the features of Down syndrome or any other dysmorphic features. There could be underlying cardiac element which you have got to bear in mind. Look at the eyes, presence of pallor and xanthomas, and examine the mouth for the presence of vitamin deficiencies, dental health, and presence of cyanosis and pallor. Examine the hands. Absent thumb in Hall-Torrem syndrome, absent radii, and presence of xanthomas. And color of the hands. Pallor again indicates presence of severe anemia. Look at the fingers for presence of clubbing, indicative of cyanotic congenital heart disease or infective endocarditis. And especially look for the signs of infective endocarditis like oscillous nodes, genuine lesions, and sphincter hemorrhages. This is the patient showing pallor of the palpable conjunctiva. And here cyanosis, that is bluish discoloration of the lips and the extremities. Genuine lesions seen on the palms of the hands. Sphincter hemorrhages and oscillous nodes. After general inspection of the patient for the findings like pallor, cyanosis, dysmorphic features, clubbing of the fingers, and edema of feet, then proceed with the palpation. Under palpation, examine the pulse. Feel the radial pulse, brachial, carotid, temporal, femoral, dorsal pedis, and posterior tibial. This is how the radial pulse is felt at the wrist on the radial side using 3 fingers. This is palpation of the dorsal pedis artery. Keep your fingers warm before you proceed to palpate for the pulse, because pulse is the tactile palpation of the cardiac cycle. It's called blood is pulsatile in the peripheral circulation. because heart contracts and relaxes. It is in the form of systole and diastole, and this causes pulsatile nature of the blood flow. Use three fingers to palpate the pulse. Distal finger to obliterate the retrograde impulse. Middle finger to feel the characters like amplitude, rate, rhythm, vessel wall thickness, etc. Then proximal finger to apply pressure to obliterate the pulse. The amount of pressure to obliterate the pulse is equal to roughly denotes systolic pressure. This is how the three fingers are used to palpate the pulse. And record the features of the pulse in the form of rate, rhythm, volume, character, and vessel wall. Examine the pulse in these arteries: radial, brachial, carotid, temporal, femoral, dorsal spinalis, posterior tibial, etc. A radial pulse is felt at the radial side of the wrist. It is felt to note the rate and rhythm, to look for radiofemoral delay. What is radiofemoral delay? Normally, femoral pulse is felt earlier than the radial pulse. This is called radiofemoral delay. When this is obliterated, when the femoral is delayed, it indicates presence of coarctation of aorta. Radial delay. When you examine for the radial pulse on both the hands, they are equally felt. Right? When one is delayed, it indicates presence of some coarctation of the aorta. So usually, right side is felt normally, left side is delayed in the coarctation of aorta. Then radial pulse is less commonly used for describing the character of the pulse. Then brachial. Brachial is felt medial to the biceps tendon at the elbow, with the thumb and with the index, or with the index finger and the middle finger. This is used to assess the rate, rhythm, and character. Well, carotid pulse is felt by pressing against the larynx or precervical muscles. Carotid pulse is used best for noting the character of the pulse and also in CPR. Femoral is felt between the midway between the anterior iliac spine and the symphysis pubis. Okay, by applying pressure on the pubic ramus of the pubic ramus. This is used to assess cardiac output, to observe for radial femoral delay, to assess the peripheral vascular disease. Then also feel for the popliteal, dorsal spinalis, and abdominis. Then describe the pulse rate. It could be normal, or there is tachycardia or bradycardia. And look for rhythm. It could be sinus arrhythmia or pulsus paradoxus or irregular pulse. Sinus arrhythmia is a normal one. There is slightly increase with inspiration and slight decrease with expiration. Pulsus paradoxus is recording of the blood pressure during inspiration and the expiration. Systolic pressure drops normally 10 mmHg during inspiration. A systolic fall more than 10 mmHg during inspiration is called pulsus paradoxus, indicative of cardiac tamponade. Then, having noted for the rate and rhythm, look for the character, whether it is high volume or low volume. High volume pulse is noted in hyperkinetic circulation, like severe anemia, thyroidoxicosis, and aortic regurgitation. Low volume or hypokinetic pulse is noted in the patient with shock, dehydration, severe aortic stenosis, and also in cases of mitral stenosis and congestive heart failure. Collapsing pulse or Corrigan's pulse is noted in severe aortic regurgitation. Slow rising anacrotic pulse indicative of aortic stenosis. Pulsus alterans is the consistently one normal pulse followed by a weak pulse. It indicates myocardial dysfunction. Pulsus bigeminy, two pulse waves close to each other. Second wave is weaker than the first. So noted in hypothyroidism, digital toxicity, hypo or hyperkalemias. These findings are very difficult to feel by palpation, more so noted by pulse tracings. Next one is pulsus bisferens, one wave with two spikes, noted in aortic stenosis with aortic regurgitation. Let us note the pulse wave tracing. This is a normal pulse. The systolic period phase of the cardiac cycle, there is ascending limb of the pulse wave followed by descending limb. In the descending limb, there is a notch indicating a second heart sound, followed by diastole. There are various pulse tracings are there with a description of anacrotic pulse, pulses at tardus. This is a low spiking pulse wave, a slow amplitude pulse with slow rising and late peak, indicative of aortic stenosis. What's happening in aortic stenosis? Stroke volume is less and the ventricular ejection time is longer. Stroke volume is indicated in the pulse as a low volume pulse, and prolonged ventricular systole indicating of slow rising of the pulse wave. This is again described as pulsus paribus, small volume pulse like anacrotic pulse, severe hypotension and severe aortic stenosis are the conditions wherein pulsus paribus is observed. Anacrotic pulse, pulsus tardus, again pulse, low amplitude pulse with slow rise and slow fall. again in aortic stenosis. Diachrotic pulse wave has two palpable waves, one peak with systole, one in diastole. So, observed in left ventricular failure, dilated cardiomyopathy, cardiac tamponade, during severe dehydration and typhoid fever. These wave patterns, as I told you, they are difficult to feel, only noted in the pulse tracings. This is pulse wave tracing. Yes, this is pulses by Gemini or pulse difference. The various pulse waves: normal, small weak pulse, large collapsing pulse, indicative of aortic registration, disference pulse with two spikes at the two waves at the peak, pulses alternates with a strong pulse followed by the weak pulse wave. This is the normal wave pattern of the pulse tracing. So this is in brief about the examination of the pulse and the looking for the general findings in the general examination of the patient, which have got the bearing on the underlying cardiac element. Keep these findings in mind so as to suspect the underlying cardiac element. Thank you for patient hearing. We concluded this moment of time. We'll meet again in the next class. Until that time, bye-bye.